Hello everyone, my name is Christopher Lee and my master topic that I will discuss about is musculoskeletal disorder. Musculoskeletal disorders are degenerative disorders where the body experiences pain around the neck and the upper and lower regions of the spinal cord. Some specific locations to where the pain is afflicting to are such as ligaments, tendons, and nerves. The reasons why musculoskeletal disorders occur within humans are because of genetic influences and sudden exertions or prolonged exposure to physical activities that individuals partake in throughout the day. Individuals cannot escape from developing musculoskeletal disorders because the different types of disorders are influenced by aging. On that note, I will talk about certain types of musculoskeletal disorders with their symptoms because the term describes many disorders. Starting off with carpal tunnel syndrome. This disorder occurs whenever there is a malfunction of the median nerve in the wrist, as you see in this image. As pressure is applied to the nerve by tightening the wrist, the median nerve will be compressed and the tissues in the carpal tunnel will swell up. Another way how individuals can develop this syndrome is by fracturing their wrists. In a scenario when an individual needs to support themselves from a fall, he or she will compress their wrists, causing the individual to experience one or more of the symptoms, such as tingles, burns, or numbness. The main cause for individuals to develop carpal tunnel syndrome is because of repetitive motions when an individual is performing his or her job for an extended amount of time. Some types of careers that increase the risk for individuals to develop carpal tunnel syndrome are such as researchers and musicians. On preventing and treating this type of musculoskeletal disorder, individuals who have carpal tunnel syndrome should make an appointment with their physicians to have physical exams to understand how serious their disorder is. I will now explain the different types of physical exams as listed. The compression test is where the physician will bend down a wrist to the extent where the thumb will be close to the forearm. The physician will hold down the wrist for a certain amount of time to distinguish any tingling or numbness in the hand. With Tinel's sign, the doctor will tap over the carpal tunnel to determine any reactions. An individual that is concerned with their health can attempt this test also. As for arthroscopy, it is a minor surgical procedure where an arthroscope is inserted into the wrist. The surgeon will then have visualization to see what is wrong with the wrist and repair it. The physician will surgically use smaller instruments inside the arthroscope to repair the wrist. A couple of other treatments are such as rest, education, medication, and stretches. As you see in this diagram, these type of stretches will relieve the pain from the wrists. The next musculoskeletal disorder that I will talk about is degenerative disc disease. With this disease, the epiphyseal discs that are made up of fibrous tissues are degenerating between the vertebrae of the spinal cord. The spine is made up of 4 curves: the cervical curve, thoracic curve, lumbar curve, and sacral curve, as you see in the image. The functions of the disc are to protect the spinal cord by acting as shock absorbers from hard impacts and allowing flexibility for individuals. The causes of degenerative disc disease are small tears in the fibrous tissue, genetics, and aging. As individuals age, they will experience back pain in a variety of ways. For example, as college students are busy writing essays on their computers, the posture that they are positioned for a lengthy time can cause them to have back pain. As for individuals in their late adulthood, they are at a higher risk than younger individuals to develop degenerative disc disease because their entire body is degenerating. The type of symptoms individuals will experience are such as pain in the lumbar region and weakness in the legs. To decrease the pain for individuals to experience when they grow older, individuals with back pain should participate in physical therapy and learn more about this type of musculoskeletal disorder to manage their back pain. As for osteoarthritis, this type of musculoskeletal disorder is a serious disorder among the aging population because of the deterioration of the articular cartilage at the end of bones. Since the cause of osteoarthritis is aging, many individuals develop the symptoms of pain in their joints. This will cause stiffness throughout the body, making individuals move with difficulty throughout their daily lives. For instance, elderly individuals that live in nursing homes need assistance by employed nurses. Even though it is possible for the elderly citizens to walk by themselves, some of the individuals will feel unstable with their body and request assistance. In addition to individuals that have developed osteoarthritis, obese individuals have issues with their joints. The joints of obese individuals are pressured at the lower joints, such as their patella region, which is also known as their knee area. On the bright side, it is never too late for individuals, including the obese and elderly people, to treat osteoarthritis. Before individuals begin fighting against this musculoskeletal disorder, some types of diagnostic tests are suggested by physicians to determine if osteoarthritis contributes to the development of any other disorders. The types of diagnostic tests that I am mentioning are X-rays around affected joints, amniocentesis, and blood tests. With X-rays around affected joints, physicians will want to determine missing joint spaces and bone deterioration. Joint spaces are gaps between two bones when an individual has a small cartilage area. Amniocentesis is a test where physicians will use a thin needle to remove small amounts of joint fluid to determine if there are any presence of other musculoskeletal disorders. After individuals take their diagnostic tests, he or she will want to start treating themselves properly. The types of treatment that individuals with osteoarthritis will focus on are such as lifestyle changes, medication, and alternative and complementary therapies. From these types of treatments, individuals need to modify their daily activities properly to benefit out of it. In recent news, researchers from the National Institute of Arthritis and Musculoskeletal and Skin Diseases are questioning whether or not bone deficiencies during childhood can persist throughout life. In their investigation, Sandeep Khosla, a researcher with a master's degree from the Mayo Clinic, and other researchers have used a new scientific instrument called the High-Resolution Peripheral Quantitative Computed Tomography to detect the quality and structure of bones. Out of the 115 adolescents that have mild to moderate trauma between the ages of 8 to 15, the researchers have determined that the children with mild trauma have weaker bones compared to the adolescents with moderate trauma. In both comparisons, the researchers have compared adolescents from mild to moderate trauma to normal children. Even though researchers from the National Institute of Arthritis and Musculoskeletal and Skin Diseases have not been able to find an answer to their question, they suggest that all individuals should improve their lifestyle by consuming nutritional products and staying physically active to improve their bone health. Now that I've explained about 3 different types of disorders under the category of musculoskeletal disorders, let's review on the different types of symptoms and treatments that individuals diagnosed with the disorders can seek out. For symptoms, each individual has their own specific set of symptoms when diagnosed with musculoskeletal disorders. The common symptoms, though, are such as pain, fatigue, and sleep disturbances. As for treatments, they include acupuncture, relaxation, therapeutic massages, medications, and physical or occupational therapy. The most important for individuals to treat themselves with are nutrition and exercise. With nutrition and exercise, individuals should both maintain a good amount of nutrition so that their body can intake the energy and utilize it when they exercise to build up muscles and develop stronger ligaments. From this presentation on musculoskeletal disorders, I hope that all of you have attained some sort of knowledge to prevent yourselves from developing the disorders while you are in the early stages of adulthood. I wish you the best of luck in the future. Thank you.